My name is Prem Kumar Shanmugam, and I'm speaking to you from Malaysia. I am a psychologist by training. I'm also the clinical director for Solace Asia. We are an addiction treatment facility specializing in all kinds of addiction treatment, including substance addictions as well as behavioral addictions. The title for my talk today is Current Tobacco Control Policies and Observation of E-cigarette Use and Smoking Cessation among residents at a substance addiction rehabilitation facility in Malaysia, which is Solace. I would like to first talk a little bit about the tobacco control policies in Malaysia. Now, Malaysia has been a member of the World Health Organization Framework Convention on Tobacco Control, also known as FCTC, since 2005. Enforcement on tobacco products, particularly cigarettes, subscribe heavily to the 6M power measures provided by the WHO. Virtually all forms of tobacco advertising and sponsorship are prohibited by the law. Graphic health warnings on cigarette packs are mandatory, while terms such as light and low tar are disallowed. Now, the sale of tobacco products is prohibited to those under the age of 18. In addition, smoke-free regulations prohibit smoking in public places like restaurants, health and education facilities, and air-conditioned workplaces. Sub-national jurisdictions may enact even more stringent smoke-free laws. I would like to share now my slides on today's presentation. E-cigarette regulation and use in Malaysia. The prevalence of vaping is 5% among Malaysian adults. To compare, the prevalence of smoking is 21%. Now, the Malaysian government imposes an excise duty on e-cigarette devices and non-nicotine containing e-cigarette liquid since January 2021. Current legal provision only allows registration of nicotine containing e-cigarette liquid under the Poisons Act 1952 to be registered as a medicinal product for use in smoking cessation. A previous health minister in Malaysia announced a bill named Tobacco and Vaping Control Bill, also called the TVCB, to control all tobacco-related products and e-cigarettes to be introduced by early 2020. The introduction of the bill has been delayed by a change of the ruling parties in the government. To date, there is still no control on nicotine-containing vaping products, despite such products circulating in the market, and despite repeated calls from medical experts, vaping industry, and public for a defined control, including taxation and prevention of underage use. Smoking use disorder. This is what I would like to talk about a little bit more. Research findings suggest a high comorbidity between illicit substance use and cigarette smoking. In the United States, more than half of adults with a lifetime substance use disorder diagnosis are current smokers. Smoking prevalence among patients in treatment for substance use disorder is 77 to 88%, which is reasonably high. Continuous cigarette smoking among patients is also associated higher as substance use disorder relapse rate. Therefore, it only makes sense to incorporate smoking cessation and prevention efforts into substance abuse treatment, which may improve long-term substance use outcomes for adult smokers with substance use disorders, while reducing smoking-related diseases and death in this group of patients. Let me show you a video and introduce you to Solace Asia, the first rehab facility in Malaysia, which started off with a scientific treatment approach. So this is Solace Asia, where we treat people suffering from substance use disorders as well as behavioral addictions. Next, I would like to talk about a case study. This case A. Up to 90% of patients have been smokers for at least 5 years, with an average of smoking at least 10 to 15 sticks per day. These are the patients who have come for treatment in Solace. Of late, I have begun to observe e-cigarette usage and its impact among residents at our rehab facility. As a number of our patients have been switching from conventional cigarette smoking to using e-cigarettes, I'd like to share 2 case studies here. Case A is a 33-year-old single male addict to methamphetamine for close to 13 years and presented to the center with delusional paranoia with hallucinations. At the time, we diagnosed him with substance-induced psychosis. He was smoking 20 to 25 sticks per day for the last 15 years. He underwent treatment with our residential clinical team for an initial period of 2 months. At the end of his stay at the rehabilitation center, he switched from smoking cigarettes to e-cigarette vaping and claimed he generally felt healthier. From a hygiene perspective, he shared he no longer smelled of cigarette. From a health perspective, he could smell and taste better while experiencing lower dependency to e-cigarettes. Overall, he felt he experienced more control over his health and habits. Now, post-discharge from residential treatment, Case A claimed to be free from methamphetamine abuse and psychosis and adopted a healthier lifestyle. He started going to the gym. He focused on healthy eating. He gained better self-confidence and maintained better relationships with family and friends. While he managed to stop smoking at 3 months post follow-up from rehabilitation discharge, he was still using e-cigarettes. Now, I would like to now talk about another case, Case B. In addition, I have been observing a ripple effect in e-cigarette use among the residents during their stay at my facility. Case B is a 22-year-old married male who was abusing methamphetamine for 2 years and presented to the facility with symptoms of anxiety disorder. He was smoking cigarettes at a rate of 10 to 15 sticks per day for the last 5 years prior to admission. Although the patient voluntarily sought treatment at my rehabilitation center for his methamphetamine addiction, he was not motivated to quit smoking at all at the start of his stay. His smoking habits soon changed during his 2-month stay, being influenced by other residents who were vaping. At discharge, Case B claimed that he was confident he could quit methamphetamine use. He did not believe he could stop smoking until he started using e-cigarettes. Now, Case B has since joined a 1-month transitional treatment program, enrolled in the 9-month internship program at our facility as well. At the last follow-up, after being in treatment for close to 8 months, Case B was still using e-cigarette and had completely stopped smoking. Let me summarize the cases and make some suggestions for future studies. I observed several similarities between Case A and Case B. Number 1, both tried e-cigarettes due to perceived benefits to health and hygiene. Number 2, both maintained use of e-cigarettes for at least 3 months last follow-up. And number 3, both had stopped smoking since using e-cigarettes. Surely, the findings of 2 case studies cannot be generalized to other residents at my treatment center, but I believe current gaps in scientific evidence can be addressed by applying structured methods in collecting real-world data on e-cigarette use and smoking cessation among substance use disorder patients at rehabilitation treatment setting. There are emerging clinical evidences on the potential of e-cigarettes as a smoking cessation tool among general smoker population. Clinical trials can even be conducted to test the hypothesis that using e-cigarettes can lead to smoking cessation and prevent relapses in illicit substance use among substance use disorder patients. Alternatively, active surveillance on safety, which follows subjects through a longer period, can be more valuable than a controlled clinical trial of limited duration. Overall, data from rigorously conducted clinical trials and structured collection of evidence in real-world settings are valuable in informing decision makers of tobacco control policy in Malaysia, which is much needed now. As a closing, I would like to state, fellow participants, Let me end by pondering these questions. 1. Is zero tobacco or nicotine use a realistic goal of any public health authority? 2. If alternatives like e-cigarette can move smokers from smoking, can we give tobacco harm reduction a shot? And 3. After all, if we can move more smokers away, the morbidities and mortality associated with smoking, what do we stand to lose? I thank you for allowing me to present this, and I wish everybody to keep safe and stay well. Thank you.